HIV testing during pregnancy is crucial for the health of both mother and baby. It's a standard part of prenatal care. Early detection of HIV allows for prompt medical intervention. This helps prevent transmission of the virus to the baby. HIV testing is recommended for all pregnant women, regardless of risk factors. Many people with HIV are unaware of their status. Early diagnosis and treatment are essential for a healthy pregnancy. Testing is simple, confidential, and readily available. HIV weakens the body's immune system, making it susceptible to infections. If left untreated, HIV can progress to AIDS, a late stage of the infection. Pregnant women with HIV can transmit the virus to their babies during pregnancy, labor, or breastfeeding. Without treatment, the risk of mother-to-child transmission is significant. However, with appropriate medical care, this risk can be reduced to less than 1%. HIV can have serious health consequences for both mother and child. Early detection and treatment are vital. There are several types of HIV tests used during pregnancy. These tests are crucial for ensuring the health and safety of both the mother and the baby. Early detection of HIV can significantly improve the outcomes for both. The most common is the antibody test, which detects HIV antibodies in the blood. This test is usually performed by taking a small blood sample from the mother. The blood is then analyzed in a laboratory to check for the presence of antibodies that the body produces in response to HIV infection. Rapid HIV tests can provide results in as little as 20 minutes. These tests are particularly useful in settings where quick results are needed, such as during labor and delivery if the mother's HIV status is unknown. The rapid test is also a simple finger prick test, making it less invasive and more convenient. If an antibody test is positive, a follow-up test such as a Western blot or PCR test is done to confirm the diagnosis. The Western blot test looks for specific proteins associated with HIV, while the PCR test detects the genetic material of the virus itself. These confirmatory tests are essential to ensure the accuracy of the initial screening. These tests are highly accurate and reliable. They help healthcare providers make informed decisions about the best course of action for managing the mother's health and reducing the risk of mother-to-child transmission of HIV. They are typically performed during the first prenatal visit. This early testing is a standard part of prenatal care and helps to identify any potential health issues that could affect the pregnancy. Early testing allows for timely initiation of treatment if needed. If a pregnant woman is found to be HIV positive, antiretroviral therapy can be started immediately to reduce the viral load in her body. This significantly lowers the risk of transmitting the virus to the baby during pregnancy, labor, and delivery. Additionally, healthcare providers can take extra precautions during delivery and advise on safe feeding practices to further protect the newborn. Knowing your HIV status during pregnancy has numerous benefits. It allows for early access to HIV care and treatment, which can improve both maternal and infant health outcomes. Antiretroviral therapy, or ART, is highly effective in suppressing the virus and preventing transmission to the baby. Early diagnosis also provides an opportunity for expectant mothers to make informed decisions about their health and pregnancy. Knowledge is power, and understanding your HIV status empowers you to take control of your health and your baby's well-being. Section 5. Preventing transmission, safeguarding infants. Several steps can significantly reduce the risk of mother-to-child HIV transmission. Taking ART consistently throughout pregnancy and breastfeeding is crucial. Opting for a cesarean section or C-section can further minimize the risk of transmission during delivery. It is recommended that infants born to HIV-positive mothers receive ART for several weeks after birth. Breastfeeding is generally discouraged for HIV-positive mothers in developed countries, as formula feeding is a safe and effective alternative. Section 6. Treatment options, a path to health. Effective treatment options are available for pregnant women diagnosed with HIV. These options are designed to ensure the health and well-being of both the mother and the baby. Consulting with a healthcare professional is the first step in understanding the available treatments and making informed decisions. Antiretroviral therapy, or ART, is a cornerstone of HIV management. This treatment involves the use of medications that help control the virus, allowing individuals to lead healthier lives. ART is particularly important for pregnant women, as it plays a crucial role in preventing the transmission of HIV to the baby. ART involves taking a combination of medications that work to suppress the virus and slow the progression of the disease. These medications must be taken consistently to be effective. The combination of drugs used in ART is carefully selected to provide the best possible outcome for both the mother and the baby. These medications are safe for both mother and baby. Studies have shown that when taken as prescribed, ART significantly reduces the risk of mother-to-child transmission of HIV. This means that with proper treatment, many HIV-positive mothers can give birth to healthy HIV-negative babies. ART helps to reduce the viral load in the mother's blood, which significantly lowers the risk of transmission to the baby. Regular monitoring through blood tests is essential to ensure that the viral load remains low. This ongoing care helps to maintain the health of both the mother and the baby throughout the pregnancy. Early initiation and consistent adherence to ART are crucial for optimal outcomes. Starting treatment as soon as possible and sticking to the prescribed medication schedule can make a significant difference. Adherence to ART not only improves the health of the mother, but also provides the best chance for the baby to be born HIV-free. Regular follow-ups with healthcare providers ensure that any issues with the treatment can be addressed promptly, supporting the overall goal of a healthy pregnancy and a healthy baby. Section 7. Support and resources. You are not alone. A diagnosis of HIV during pregnancy can be overwhelming, but support and resources are available. Medical professionals, including obstetricians, infectious disease specialists, and counselors, are there to provide guidance and care. Support groups and community organizations offer a safe and confidential space to connect with others who understand the challenges of living with HIV. Remember, you are not alone on this journey. Reaching out for support can provide emotional strength and practical assistance. Section 8. The importance of early detection and care. Early detection and treatment of HIV during pregnancy are paramount. Timely interventions can significantly reduce the risk of mother-to-child transmission. Knowing your HIV status empowers you to make informed decisions about your health and your baby's well-being. HIV testing is a routine and essential part of prenatal care. If you are pregnant or planning to become pregnant, talk to your healthcare provider about getting tested for HIV. Section 9. A healthier future. HIV testing makes a difference. HIV testing during pregnancy is a critical step towards a healthier future for both mothers and babies. It is a proactive measure that empowers expectant mothers with the knowledge they need to make informed decisions about their health and the health of their unborn child. By knowing their HIV status, pregnant women can access the necessary medical care and support to manage their health effectively. This not only protects their own well-being but also significantly reduces the risk of mother-to-child transmission of HIV. By embracing testing, accessing care, and adhering to treatment, we can prevent transmission and ensure the well-being of generations to come. The process of getting tested is straightforward and can be done during a routine prenatal visit. Healthcare providers are trained to offer compassionate and confidential care, ensuring that every woman feels supported throughout the process. Once tested, if a woman is found to be HIV positive, there are effective treatments available that can help manage the virus and maintain a healthy pregnancy. Early detection and intervention pave the way for healthy pregnancies and brighter futures. With early diagnosis, healthcare providers can implement strategies to prevent the transmission of HIV to the baby, such as antiretroviral therapy and safe delivery practices. These interventions have been proven to be highly effective, allowing HIV-positive mothers to give birth to HIV-negative babies. Moreover, regular monitoring and follow-up care ensure that both mother and child receive the best possible outcomes. Remember, HIV testing is a simple yet powerful act of self-care and a testament to the love and commitment we have for our children. It is a step towards a healthier future, not just for the individual, but for the entire family. By taking this step, we are investing in the health and happiness of the next generation. So let us embrace HIV testing with open hearts and minds, knowing that it makes a profound difference in the lives of mothers and their babies.